This lecture will cover endocrine pancreatic neoplasms, including the insulinoma and the gastrinoma. Use the forward arrow to move to the next slide. If you are using PowerPoint to view this presentation, make sure to open it in the slideshow mode. As you are navigating through the slides, you will see a pancreas icon. Click on it to hear more about the subject. YouTube users, the video will automatically play all sounds in key link terms. An insuloma is part of the endocrine pancreatic neoplasm family, and the endocrine pancreatic neoplasms arise from the islets of Langerhans. The islands contain the alpha, beta, and delta cells, and the insulomas are made from the beta cells. So insulomas are also known as a B cell tumor. And when a patient has an insuloma, the insuloma or the B cells of the pancreas produce excess insulin. So these are functioning insulomas. They produce excess insulin because they're made of the cells that make insulin in the pancreas. This is the most common functional tumor, and of the endocrine pancreatic tumors, it comprises about 60% of them. Typically, these are going to be benign, but 10% of the time they are malignant. There are three things that go into the classic clinical triad for insulomas. The first being that the patient is between 40 to 60 years old, that they have hypoglycemic symptoms, and once given glucose through an IV, the symptoms resolve. Some other symptoms that the patient might feel are heart palpitations, headaches, confusion, sweatiness, and possibly even coma. Those are all related to the hypoglycemic state. Because the insulomas produce excess insulin, then we'll see an increase in insulin in the blood levels. Treatment for an insuloma includes nutrition therapy, surgery, and chemotherapy, and prognosis with the insuloma is typically relatively good unless the tumor is malignant and has metastasized. On ultrasound, the insuloma or B cell tumor is going to appear well encapsulated within the pancreatic tissue. It'll be hypervascular, and they can present with calcifications. Insulomas are actually very hard to see on the pancreas, and ultrasound is not the best modality to image them in. The gastrinoma is another tumor found in the endocrine pancreatic neoplasm family. The gastrinoma is also known as a G cell tumor. The G cells or the gamma cells are also found in the islets of Langerhans and are responsible for endocrine function. They really only make up about 3 to 5% of all of the pancreatic cells, so there aren't a whole lot of these cells within the pancreas. But when a G cell tumor forms, it is functional because it produces excess amounts of gastrin. Gastrin then is responsible for telling the stomach to produce hydrochloric acid and pepsin. So when this gastrinoma is active and producing that excessive gastrin, the patient has excess acid within their stomach, which leads to peptic ulcers within the stomach, and this process is what defines the Zollinger-Ellison syndrome. So again, the Zollinger-Ellison syndrome requires the presence of a gastrinoma producing excess gastrin, which results in more hydrochloric acid and pepsin, which causes peptic ulcers. When a patient is diagnosed with a gastrinoma, we are more concerned for this neoplasm to become malignant, as this one does become malignant 60% of the time. Patients who are most likely to develop gastrinomas or the Zollinger-Ellison syndrome are going to be younger adults, and these younger adults are going to have a history of peptic ulcer disease. And these ulcers are going to show up in kind of odd places, usually within the stomach, in the pancreas, or in the duodenum. These patients are also going to most likely have a history of significant diarrhea due to the excessive acid that is produced by the stomach. As far as lab tests go, the gastronoma produces excess gastrin, so blood levels of gastrin will be elevated. The treatment for gastronomas is first going to be some sort of proton pump inhibitor, so something that stops the hydrogen or hydrochloric acid from being produced. If that doesn't work, then surgery to remove the gastronoma is an option. Otherwise, a lot of times these patients have gastrectomies, which is the stomach being removed. And if the gastronoma is proved to be malignant, then chemotherapy is indicated. As long as the gastronoma is removed, then the patient typically has a good outcome. On ultrasound, these lesions are going to be very difficult to see. If we do see them, they are very small and hypoechoic and can be seen within the duodenum or in the pancreas.